Hi, I'm Dr. Patel here at the Tooth Experience here in Edmond, Oklahoma, and we're going to talk about cavity prevention. One of the biggest misconceptions with cavity prevention is that something has to hurt for you to have a cavity. That is very much incorrect. Teeth can decay, and we really don't start feeling any issues with it till we get to the nerve and the pulp of the tooth. There are two layers into teeth, enamel and dentin, before we even get to the pulp, and so that is quite a bit of a misconception. The other thing that we want to keep in mind is cavities are very easily preventable. We want to make sure that we're taking the proper steps and the necessary steps to kind of keep cavities away. So what a cavity is when bacteria build up on our teeth and they sort of eat the sugars and the things that we're eating and leave acid behind. That acid causes our teeth to soften up and decay and lead into holes where the bacteria can start living and further progress and build up. So the main thing is we want to get rid of the sugars and things like that. So a misconception that I commonly get is I have to stop eating chocolates and things like that. Really what it is the stickier things, so like Laffy Taffy, licorice, sugars that are a lot more sticky. That could also be like bread, tortilla, things like that stick on our teeth. And so the main thing we want to focus on is brushing after we eat. That's one of the easiest ways we can avoid cavities and kind of not have to do any fillings or save money and things like that. We also want to make sure that we are doing small things that help. So when a dentist is recommending sealants and things like that, our teeth have little crevices and things like that, so the dentist can go in, fill in some plastic, make the tooth nice and smooth. That way we're keeping the tooth clean. It's easier for the patient to brush and make sure they're getting rid of all the bacteria, all the food particles that are in there. And so that way you don't have to come in for a toothache and come in for a root canal or the more expensive things. A root canal is when we have to go in, the decay has gotten into the pulp, we're afraid the bacteria is living inside the canals of the tooth and things like that. So the dentist has to go in, kind of open it up, clean out where our nerves, arteries, and veins of a tooth sit, and fill it up with dental material called gutta percha and kind of seal it off to the rest of the world. That way we make sure that we don't get any infection in the bone, abscesses, things like that. And so those are the things that we really want to avoid, and we can do that by simple cavity prevention methods like keeping our teeth clean, brushing daily, making sure we take care of small cavities when the dentist is recommending it, and go from there. Symptoms of cavity, the most common one we hear is sweet sensitivity. It can also start into being hot and cold sensitive, things like that. Sometimes patients also notice a darker stain or something that is visible, looking different than the other teeth. And so if you notice any of those things, definitely get in, talk to your local dentist and consult with them. So sealants we often see recommended in kids. They can be done in adults, but most of the time we're recommending them in developing kids, mainly because they're getting these permanent teeth coming in. They have deeper crevices, little notches and things like that. So the dentist will go in, clean off the tooth, make sure that they're nice and smooth. They fill a sealant material to kind of seal over and make sure that they are able to keep the tooth clean. So we're going to recap the cavity prevention techniques. The main things that we want to make sure is cleaning off the sugars that are living on our teeth. That way the bacteria can't eat into them. And we want to make sure that we're brushing after meals, doing sealants. And the other thing I want to make sure is you're taking care of all the small cavities that need to be taken care of before they get big and turn into root canals or things like that. So guys, I am Dr. Patel here at the Tooth Experience, and I want you to like, subscribe, and follow. I want you to hit that notification bar. That way you can continue to follow me as we talk about issues like cavity prevention in the future.